Newhouse.
Thank you, Mr. Chairman, Mr. Ranking Member, for having this important hearing, and also thanks to our guests here for your important testimony. It's a very important topic. It's something that deals with not only our economic security, but also national security issues and the general health and well-being of our American citizens. So I want to start with Mr. Cashman, if I could. Thank you for coming, Mr. Cashman. Appreciate your testimony. You talked about the amoxicillin shortage back in 22 and 23. So if you could, I'd like you to share a little bit more about what you went through during that period, but also help us understand what the federal government could be doing to support manufacturers to help prevent shortages. And if they do occur, if shortages do occur, what kinds of things should we be thinking about to help mitigate those impacts?
Thank you, Congressman. Excellent question. In 2022-23, we were just getting back, restarting our facility. So we were starting to ramp up production, scaling up, hiring people, bringing the production back online. And unfortunately, we weren't fully ready to deal with a shortage like that. We did the best we could, and we ran as hard as we could to do that. And we were able to provide quite a bit of medication to people. What needs to be done? I think there needs to be additional investment in equipment, in bringing people, in training people, and bringing people online to train more, to have higher levels of production. I think one thing that's very important to consider for this group is that the federal government buys a lot of medication, and that can help drive U.S. domestic manufacturing. The small business set-aside paradox is really something that is very quickly, easily remedied. It requires no appropriations, no regulatory overhaul, no international negotiation. It just requires a narrow clarification that national security considerations can override set-aside classifications when a genuine domestic manufacturer of a critical medication is excluded from competition. So just using that demand as a lever to help generate and drive domestic manufacturing can be very helpful to domestic manufacturing.
Okay, appreciate that. Thank you.
Can I chime in on amoxicillin?
Oh, sure. Just real quickly, sure.
Just really quickly, so amoxicillin was a really interesting shortage. It was really driven by a demand increase. And this is a great example of us competing with other countries and us potentially losing because of how our system is structured. We pay a lot less for generics than other countries do. We pay a lot more for brands, but a lot less for generics. And what was really interesting is that for manufacturers to shift more of their sales to the United States, basically, they were getting paid more in Europe for these drugs, but if they were to sell them here at anything like the prices that they were getting somewhere else, they would have to pay Medicaid inflation rebates. So we were sort of in this very uncomfortable position, manufacturers were, to sort of how do you play here when somebody else outside of the United States was paying them more? And I'm not talking about China, I'm talking about Europe. So, you know, if you look at my testimony, I do, and I have written in the past that we need to be also thinking about some of the payment mechanisms and potentially making adjustments there.
Interesting. Thank you. Dr. Jimenez, in your written testimony, you talked about the fact that your firm does not directly work with Chinese biotech industry. Could you share a little bit more about your decision to not invest in Chinese biotech? And also, you mentioned that American firms with investments in Chinese biopharmaceuticals are often fearful of testifying or speaking publicly. What have you heard firsthand from colleagues in the industry, particularly with those that have invested in China?
So, despite the fact that we're saying that it's they have great data and it's much cheaper, you have to have boots on the ground in China to be able to do this correctly. You need to have people who go in, who speak the language, who you trust. You have to be able to diligence their documents. You need to have translators to read Chinese documents. And it's actually a pretty significant investment to be able to go there and truly diligence any kind of products there. So we've seen this happen with pharmas who set up joint ventures a decade ago, And then we've seen this with emerging life sciences groups who have spent a lot of resources and hired out teams local to China, and that wasn't an investment we were willing to make. We've been offered and certainly had board-level discussions with our companies to set up JVs in China. Our concerns there were basically that you're giving up your IP, and you will end up seeing a copycat there. So from a risk-benefit decision, we decided not to.
Mr. Chairman, just trying to follow your lead and going over time, and I yield back.